just get started, and if people trickle in, they can kind of jump in. My name is Maggie Nadeau. I am on the talent acquisition team here at WellNow Urgent Care. I myself, Elizabeth Munkenbeck, also goes by Lizzie. Some of you may have already talked to her, and then Emily Prickett. We're all on the talent acquisition team. So we're the ones, hunting down your resumes, giving you the talk first, and then we also have our regional and lead providers on the call with us as well. So I'll give them a chance to introduce themselves in just a minute. But this is our last Ask Me Anything for 2022. I can't believe the year has already come and gone, but a lot of exciting things have happened this year with our fellowship program. So this is kind of just going to give you a recap of what you can expect with the program now, if you're interested in joining in the next couple of months, and kind of how that looks from there. We are currently in about 200 sites in 2022 in 7 different states: New York, Ohio, Michigan, Illinois, Indiana, Pennsylvania, and Wisconsin. And we're opening even more sites in those states. So really exciting stuff for 2023, and we'll talk a little bit more about that. We had about 200 fellows start with us in 2022. In 2023, we're looking at about 300 added to that. So that's really exciting. We do see the fellows as the future of our providers here at WellNow. So really great opportunities there for some of you. I'm going to turn it over to Nick. Do you want to go ahead and introduce yourself and maybe get us started?
Absolutely. Hi, everybody. Welcome. My name is Nick Pashik. I'm one of our regional leads. I cover mostly New York and Pennsylvania. I'm a PA. I've been with WellNow for almost 5 years, and I've been with the fellowship for about 4.5 of those years. Started off just having fellows with me, and now I get the opportunity to talk with you guys now. So that's pretty cool. Our fellowship program, Maggie, am I supposed to talk about the fellowship program now?
Yeah, if you want to go ahead and just talk about the program, and then everybody else can introduce themselves real quick.
Okay, real quick, just a quick synopsis of the fellowship program. It's a 12-month fully accredited program. It's geared mostly towards new grads, but we do have providers that have some experience in some type of specific specialty. It's for PAs and NPs. We take you through the program in a very much a kind of a crawl to run model. You have lots of time to build your skills, including actual medical skills and medical knowledge in urgent care medicine. You work directly with some of our providers. You have a lead fellowship provider that guides you through the program. It is a mixture of clinic time and didactic, as well as homework. We provide you with all the resources to do the homework and learning. There's textbooks, there's online modules, there's live lectures. There's lots of opportunity to learn based on how you learn as an individual. We work really hard in our program, and we're very proud of how far it's come. Many of our people that graduate end up signing on with us, and are some of our best providers that finish the program. Just recently, we had a graduation class that most of them, about half of our top bonuses went to new fellows.
Awesome.
We'll get into the nuts and bolts tonight, though, guys.
Thanks, Nick. Go ahead, and David Gilmore, do you want to go ahead and introduce yourself?
Sure. Hi, I'm David Gilmore. I'm a physician assistant. I practiced emergency medicine for well over a decade, and then started with Physicians Immediate Care, which is now part of WellNow, about just short of 9 years ago. I was the director of advanced practice providers there for about 4 years, and have been working with the fellowship. I've been a regional lead fellowship provider pretty much since the merger with WellNow.
Awesome. Yeah, David's been a great addition to our fellowship team, so we're really excited about that. Liz, you want to go?
Sure. My name's Liz Benasan-Messon. I happen to be a PA as well, one of the regional leads, and work with fellows in Ohio, Michigan, Indiana, and I've been here for just over 7 years. Time's flying. Kick it over to my counterpart in Ohio.
I guess that's me.
Yep.
I'm Martin Christensen. I'm a nurse practitioner. I've worked for WellNow for a couple of years now. Been in this role as a lead fellowship provider in Ohio for 15 months. Graduated 2 classes, so it's going well, and excited to talk you guys through what all we have to talk about.
Perfect. Thanks, team. All right, we'll go ahead and just jump into some of the questions that we had pre-submitted. So I'm going to start with you, Liz. Is there a lot of opportunity for hands-on learning, such as doing our own procedures, suturing, splinting, incisions, and drainage?
Yep. There is absolutely a lot of hands-on opportunity, and actually starts from the week of orientation. So even during orientation, we actually have an entire day dedicated to skills, from suturing to splinting, injections, etc. We understand that our fellows come in, especially with suturing, with a very differing amount of experience. And so we really try to help them hit the ground running. But then, like Nick said, it's a combination of didactic and clinical. So there continues to be numerous opportunities throughout the whole year to practice all of those things, as well as additional kind of one-on-one time if needed.
Perfect. Sorry to everybody else on the call. I should have kind of jumped into that a little bit more. From here, now that you've met the team, we're going to go ahead and look at all of the questions that were pre-submitted. If you do have questions along the way, go ahead and pop them in the chat, and Lizzie and Emily are going to be looking at those, making sure we can answer as many as possible. This is really just an hour to go over the details of the fellowship and give you guys the information to that you need in order to look into it. So should have said that before, but thanks, Liz, for going and answering that one. Martin, do you want to talk a little bit about the culture here at WellNow?
Yeah, I mean, we're a customer service first company. You know, our founder, John Radford, initially had called us 5-star urgent care because that's the kind of service we wanted to give. So, you know, taking care of patients and clients like we take care of one another. We have a team mentality, and, you know, we're always willing to help one another. Try to deliver amazing care while continuing to learn and train. That's where the fellowship comes in. And, you know, we always joke that the only thing that stays the same is change. We're always looking to grow and make things better, both for our staff, our patients, and providers.
Yeah, definitely. Jumping back to the basics, Nick, do you think you could tell us kind of what the expectation is for NPs and PAs coming onto the fellowship?
Yeah, so we really expect, the easiest way to put it is a positive attitude and willing to learn. It's a lot of things to learn. It's a lot of dedication. You have weekly assignments, homework, and you're learning a lot in clinic. We're trying to incorporate 2 to 3 years of emergency room and urgent care experience into 1 year. And what's required is basically willingness to learn and put in the effort.
David, is outside work allowed, you know, while you're going through the fellowship program?
No, no is the short answer. So because you will be doing a fellow does clinical shifts, approximately 10 to 12 shifts a month, in addition to Wednesday didactic lectures and homework. There really isn't much other room for working, and we find that the fellows that are most successful are the ones that really focus on, you know, learning both in the clinics and at home with the didactic lectures and homework.
Perfect. Liz, how long does credentialing take for either a new or seasoned provider?
Yeah. For someone more seasoned, it can be as short as 30 days. Sometimes for newer grads, it takes a little longer, but that can be more because of the licensing for sure. So as a new grad, going out, getting that license for the first time can take a little time depending on the state. And so especially we have to have that license to get you credentialed. So it can take up to a couple months because of that. But our credentialing team is very good and works very, very fast, especially compared to a lot of hospital systems.
Perfect. And then can you answer, do you have to have the appropriate state license to apply, or can you obtain one after accepting the fellowship? Did you catch that? There was a plane going by right when I said
Yes, I did. So you don't have to have your license to apply, but you absolutely have to have it to start. So could someone go ahead and apply without it? Sure. But really we encourage people. We do have sometimes people apply while they're in school to really get that ball rolling so that they understand that, well, sure, they could apply, we could extend a position. You're not going to be able to start until you have that license. Because like Nick said, that year goes by really fast, doesn't feel like it, but you need to have that license so you can be seeing patients from the get-go.
perfect. I'll go ahead and answer this next one. They asked, what is the interview process like for the fellowship program? How long until I hear if I am selected? So you will either talk to Lizzie, myself, or Emily, depending on what state you're in. We will do just an initial phone screen with you. Usually doesn't take any longer than 15 or 20 minutes. From there, we schedule an interview with either a lead or one of the regional providers. And that's going to be more of that formal interview. It's going to be through a video conference call through Microsoft Teams. That interview usually takes about 45 minutes, 30 to 45 minutes, depending. And then from there, we typically make the hiring decision, usually by the end of the week. So you'll be hearing back from us pretty promptly. It's a pretty quick process. But yeah, it's enough to get you up and going, and we're pretty fast at responding to you on that. Martin, will I have to work holidays and weekends?
So weekends, yes. So we are a 365-day-a-year operation. Weekends typically, it's kind of half the weekends of a month. So every other weekend, give or take. And then holidays, yeah, it's pretty dependent on kind of your area, what phase you're in, and what the location needs are. I would say that our fellows are typically not given the bulk of the burden for holidays. And when they do work holidays, it's done in kind of as fair of a manner as possible.
Awesome. Nick, can you answer this one? How does WellNow value diversity? What steps have you taken to ensure WellNow is diverse?
We absolutely do value diversity. We want the more the merrier, honestly. It is a culture that is a zero tolerance for any type of discrimination, but we want everybody. That's the easiest way to say it. We love diversity. We celebrate all the good things, and please don't be afraid to apply.
Yeah. David, can you tell us what locations are available?
So you talked about a little bit so we have across all 7 states and almost all of our 200 sites, there are locations available. Not all sites are available at all times based on depending on how many fellows we have at those sites already, but pretty much across the entire company there are sites available.
Perfect, thanks. As far as salary and benefits and things like that go, Lizzie, do you want to answer that one?
Absolutely. So, this is a training program, so we are pretty competitive in that respect. Our salary ranges anywhere from about $75,000 up into $90,000, and that's dependent entirely on the state and region that you're in. So during the phone screen process, obviously we will talk you through that and talk about specifics about your training location.
Perfect, thanks. Liz, is there CMEs offered to help fellowship providers? What does WellNow cover for fellowship hires?
I always tell fellows that you'll have more CME than you know what to do with. So for didactic, which we have every Wednesday morning, which is 3 to 4 hours, you get category 1 CME for that. We use 2 big online modalities called Med Mastery and Core Content of Urgent Care Medicine. That's what a lot of our homework is through. You get category 1 CME for doing that as well. We get urgent care wraps, just like all core providers, up to date as well. Textbook of urgent care medicine. In addition, they are handed back in at the end of the year, but our fellows get laptops to use throughout the year. We reimburse for licensing, DEA, Yeah, so we often get asked, what do I need to purchase to come in? Like, nope, if you accept a position, we get you these subscriptions for these things. We get you the textbooks and hook you up with all these things. Yeah.
Yep. Awesome. Martin, are providers expected to see a certain amount of patients per shift, or would this apply to fellowship participants?
Our company for our core providers has kind of some benchmarks as far as how we manage whether there's going to be one provider in a clinic or two providers. And then for our fellows, we have some goals with each phase. But over time, you learn to be more efficient, see patients more quickly, document on them more quickly. The goal is for each phase to allow a fellow to be more comfortable seeing more patients an hour.
Perfect. David, this is a good question. How much traveling between locations will be expected to do, and how far away will we be expected to travel? Could you answer that one for us?
Absolutely. It can vary depending on the region as far as how far apart. It's usually about 50, the maximum is generally about 50 miles or 50 minutes if you're in a dense urban area like in Chicago. Going 10 miles could take you an hour. So that varies a little bit. How many, as far as like how many clinics in an area, I think that was in the chat. That again depends on the region. Some of the more rural areas, it may be 2 or 3 clinics. In an urban area, it can be 5 to 10, depending on how close together they are.
Mm-hmm. Liz, I know that Nick mentioned this earlier a little bit, but are fellows eligible for monthly bonuses? And then maybe I'm going to talk about what Liz was talking about, or Nick was talking about with the bonus. Or she could go back to that.
Fellows are not eligible for a monthly productivity. Kind of what I think Martin was saying too. It's not our goal that fellows are just churning out patients. This year is about that people are here to learn, and you will find that you are slowly, which will educate and help, able to ramp up so that you can safely and comfortably see higher patients per hour. So like what Nick said earlier, when you come out, that yes, you can come out if you sign with WellNow, earning that bonus. So if fellows graduate and sign as a core provider, the very first month as a core provider, they're eligible, but not during the fellowship, because that's not the goal or intent. Mm-hmm.
Okay, perfect. Thanks. Confused you with that question. Sorry. I'll answer this one. Would I be paid weekly, bi-weekly, or monthly? It is bi-weekly. Martin, during the first year of the fellowship, are you able to take any days or time off?
Well, sure. Yeah, you don't have to work all the time. No. So yeah, as a fellow, you get PTO just like any regular employee. We have kind of some rules built in with how your schedule's built, where you can just ask off for random days without utilizing PTO. I always like to say that the year of the fellowship is stressful. You're learning a lot. You're in different places. You're interacting with a lot of different people, and I want the schedule to be one of those variables that doesn't cause you stress. Right now, can we always individualize it to a T? No, but if being off a random Thursday helps your life a whole lot, as a LFP, I want to hear about that so we can accommodate you. So yeah, you get PTO like every other employee. We certainly encourage our fellows to take their time off they're given and recharge to come be busy in clinic the next day.
Perfect. Nick, can you tell us how long is the program?
Yep. So it is 12 months. We are accredited, so it's a minimum of 12 months. Occasionally, it is a little bit longer for a couple of people, and that's okay. That's no problem whatsoever. But it is a minimum of 12 months.
And then can you also tell us when the program starts?
Oh, we got you guys. Anytime you want to start, we can accommodate. We like small classes. We have lots of opportunities. So basically the 4th Monday of every month, we have a new class starting.
Perfect. David, is there a time commitment past the 12-month fellowship program?
You're muted, David.
Why are you always yelling at me? No, there is not. So if you're signing up for the fellowship, you're signing up for the fellowship. Now, we certainly like to hire as many of the graduating fellows as possible, because we've trained them and we know they're quality providers. But you are not required to stay on with WellNow after the fellowship.
Perfect. Liz, would I have to sign a non-compete?
So our fellows do not have to sign a non-compete in their contract. No, we keep referring to core providers because, again, exactly what David just said, a lot of them stay on with us. So when you graduate, if you stay on as a core provider with WellNow, our core providers, including ourselves, we do sign a non-compete, but those fellowship contracts, no, we do not.
Perfect. This kind of goes right along with those other questions, Martin. Is there room for advancement at WellNow?
Absolutely.
Yeah.
No, that's one of my favorite things about WellNow, especially for APPs, MPs and PAs. I think there's a unique amount of opportunity for advancement, whether it's within the fellowship or operations or even clinic lead, things like that. We have lots of opportunity, and we certainly, I think the current leadership notices those fellows pretty early on that are going to be moving into some of those roles as time goes on. So the fellowship's a good stepping stone if you are looking for advancement as well.
Yeah, perfect. David, back to you. This is a good question. Will we be working with multiple providers? Or are we assigned to a specific person to follow during the program?
Yes to the first half, no the second half. So yes, a fellow would work with multiple different providers at multiple different sites. How many providers and how many sites, again, depends on the region. You would not be assigned to follow a specific person, but there's a specific person assigned to follow you. I don't know if, I think someone even used the acronym LFP, the lead fellowship providers. So every region has a lead fellowship provider that works with those fellows throughout the time. But as far as in the clinics, you are going to be working with different providers on different days.
All right, perfect. All right, Nick, this one is, you can be long-winded this one, I'm sure. What will I learn as a fellow provider at WellNow? What won't you learn? Maybe that's
I'm sorry. Say that again. How am I gonna commandeer the rest of this talk? Apparently.
Yes, basically. Do you really need me to repeat the question?
I actually do. I'm sorry.
Okay. What will I learn as a fellow provider at WellNow?
Oh, you're gonna learn everything. So our curriculum is really robust. It's system-based. We cover a huge textbook that I happen to have right here. So everything in the 12 months you guys will be covering. And it's a mixture of the reading and the modules, and it's a little bit redundant. You get a lot of the same stuff over and over again. But it is a very long curriculum. Everything and as well as procedures, so suturing, IND, splinting, pelvic exams, foreign body removal, and everything you can think that could come into an urgent care, and occupational medicine. And as you guys know, anything can come into an urgent care. We're kind of the experts in nothing, but really good at everything.
Perfect. Martin, back to you. How many hours are fellows required to work, and what does the schedule look like?
So like David got into a little bit, it's a full-time position. It's 160 hour a month contract. The schedule is pretty fluid. I would say in most of our areas, the bulk of the shifts are 12-hour shifts, but we do mix in some 10s and 8s. And then your time is broken down as far as how much you are required to do clinically, a little bit different with each phase. But we do build in time for that Wednesday didactic piece. So the most clinically you're doing or scheduled for is around 144 hours a month with the didactic piece built in.
Perfect. And then also this one kind of goes along with it, since you're so big on fashion. What do I wear to work as a fellowship provider?
You get to wear our beautiful galaxy blue scrubs. we get you those with your name embroidered on them, and you show up just looking real fancy, as I'd like to say.
Very in style. Liz, will I acquire any certifications as a result of being a fellow?
Yep. I mean, the biggest one, of course, on completion is a 12-month accredited urgent care program. There are definitely other fellowships out there, but there are not very many accredited ones. So, of course, on completion, you will get a certificate for the program. In addition, all of our fellows become DOT certified, which WellNow pays for. And then in New York, you get workers' comp certified as well. I say New York because the other states is not required. So, but yep. Mm-hmm.
Awesome. David, this kind of goes along with the accreditations. If I have not applied for my DEA license yet, is that something I should aim to have done before the start of the fellowship if selected?
It's something you someone can aim for, but if you are, especially if you are a new grad, you have to have graduated, pass boards, have a license and an NPI number all before you can apply for a DEA number. So we don't require that prior to starting, because not everyone will have that. We do want you to get it as soon as possible once starting or applying.
Perfect. And then Martin, last one for you, I think. Well, maybe unless we have some more in the chat. Does WellNow require the COVID-19 vaccine?
No, that's pretty easy.
Wait. Nick, what happens once I graduate the program? Will I be offered a full-time position?
Absolutely. So that's actually coming up for a group of fellows we have graduating April 1st. Usually about month 10, we start looking at candidates and see where the opportunities lie, and job offers go out very shortly thereafter. Therefore, you're prepared to sign on when you finish the fellowship. If for some reason it's a position where you're not interested in the long term, or it's something that you want to go somewhere else, you actually have time to find a new position. We give you time for that.
Perfect. That was the last of our pre-submitted questions. Do any of you panelists have anything additional you want to add about the fellowship?
Well, thanks for putting us on the spot, Maggie.
Yeah.
Sorry. Any fun facts about the fellowship?
Yeah.
The fellowship is where the fun is.
We are the most fun.
Yeah.
I mean, that goes without saying.
And not nerdy or goofy at all.
And honestly,
what are you guys looking for in applicants?
Well, honestly, kind of.
Someone just answered it.
Yeah. Honestly, a willingness to learn and a good attitude. We're going to be here to teach you medicine. We're going to be here to teach you urgent care medicine. We're going to be there to support you and guide you. We're going to give you every resource available to make you successful in urgent care medicine. You just have to be willing to learn.
And it sounds silly and super cliche to say that, but it's super true. You know, I've had a couple of fellows that have come in that were as green as they come, and they showed up to work excited and were enthusiastic and got in there and got their hands dirty, and one of them is just recently in phase 4, and she's certainly somebody that we're going to be keeping on, I can imagine. So just showing up with a good attitude makes really all the difference.
I think the only other thing I would add is, and we actually teach on it throughout the year, is it's not something you've already learned about before doing, is kind of checking in on your own emotional intelligence, because we do give a lot of feedback throughout the program. And so I think the only other people we see sometimes struggle is people who struggle a little bit with self-awareness. Most of our fellows do amazing, but really we try to have really positive and constructive feedback. And so just really being ready, because we just want you to be the best provider you can be. Good medicine is the standard. We want to go beyond that.
Can somebody clarify, are all WellNow sites eligible for the fellowship program and training?
Yes, absolutely. Even our sites that are, we have a site in Plattsburgh, we have a site, you know, we have some coming in very northern Michigan. Yeah, absolutely. We will work with you if that's where you live and that's where you want to go. Absolutely.
Okay, we got another one. Am I able to apply after I graduated, but prior to taking boards and obtaining licensure to start in a rotation after I pass the board?
You would
Seems
need your
like a
license to start because
License
like we talked about
certification.
earlier, but sure, you could absolutely apply. Someone asked that they're graduating in April. I mean, you can technically apply whenever, but I think it's hard for people sometimes, like maybe wait till the holidays, enjoy your holidays, then maybe start that process and you can get it rolling. But you will have to have your license to start because you need that. Some states are really fast on that licensing. Ohio, Michigan are very friendly to that. Indiana, Illinois, I don't know what they have against providers, but they do not want to make it easy. New York is in the middle.
Between. We're like in between.
Pennsylvania's, yeah. Ohio, Michigan, Martin and I, they'll license anybody out here.
I'd like to grab one of the questions from the chat. It says the job description on the location I was looking at stated that 2 to 3 years of ER, I think it says ICU, but probably meant urgent care experience is preferred. Does that mean experience is an RN? No, I think I think that was a core provider position. For our core providers, we require either 2 years of ER experience or 3 years of urgent care experience. This fellowship is kind of in place of that experience. Like we take new grads, we teach them urgent care for a year. After graduation from the fellowship, you can apply for, or near the end, you can apply for a core provider position with WellNow. And that because you've gone through the fellowship, you do not need that 2 years of ER or 3 years of urgent care experience.
I think we missed this one too. I'll be graduating in April of 2023. When do you recommend I apply and when would I know if I would be accepted? I can actually answer that. So obviously if you're interested in the program, I definitely encourage that you reach out to either myself, Maggie, or Emily. We're going to send out all of our contact information at the end of this. We can chat a little bit more about the program, get you scheduled for an interview. And then from there, you will know usually within a week if we're going to offer you a position. We have a lot of great candidates who have signed all the way, in advance of I guess it's spring 2023. So, sign on early. We'd love to have you.
Yes, new grads cannot be a core provider with us without going through the fellowship or having that experience. So. Any other final thoughts or any final questions for anybody? We covered a lot in a short amount of time, so it's impressive.
I think this was a record for us. I'm very, very proud of us.
Yeah.
References or letters of recommendation? Not at this time, but things, as Martin said, are constantly changing.
I think we just brought that up earlier today.
We did bring that up. Yeah.
I believe it was Bob Dylan said the times they are changing, not me.
Sounds like Bob Dylan. I guess, honestly, speaking of change, that's probably the other characteristic that those that succeed in the fellowship, they're just okay with change. They just roll with it. It's a part of life. It's part of healthcare. We're a company that's constantly trying to do better. They're better for our patients and better for our clients and better for our staff. And so the only way to get better is to make changes.
But that feedback goes both ways too. So we literally just sat down earlier talking about some feedback that we asked for from the fellows last week to talk about that. How do we make changes based off what they're asking for? So it definitely goes in both directions, which I think is something that's very unique about WellNow. It's not just the fellowship, across the company, that feedback really goes both ways, and you actually see change from that feedback.
Yeah,
Sorry,
to expand on what Liz was just saying, the ability for your just day-to-day employee to engage with kind of our C-suite level leadership is very unique here. They all make themselves available for essentially weekly open office hour type calls, and are really, kind of hungry for that feedback. They want to know what's going on, boots on the ground, and be aware of those things that need to be changed, be aware of, wins, losses, and everything in between. I've never worked for a company where I could literally, just get on a call and say something to my CEO once a week scheduled. So we have a lot of access to that at WellNow, and it's a big driver of change.
I mean, obviously our leadership, we're kind of really hard to get along with, as you can tell. Super strict people, zero personality.
And not sarcastic at all, right?
No.
Someone
No.
asked a question in the chat. Yeah. So I would say the majority are 12 hours, but like Martin said, definitely sometimes have people do some 10s or 8s, but the vast majority are 12s. Mm-hmm.
Anything else? Any other final thoughts? This is your guys' time to shine, and that includes didactic, yes.
Well, clinic hours are 8, 10, or 12. Didactic is something separate. And earlier there was a question about hours. The fellowship contracts say 160 hours a month. I got to be honest, guys, this is a training program. So if you're not very good at a topic, you're going to be spending way more than 160 hours that month. So be prepared for that. If you're not good at ortho, which is a challenging subject for a lot of our fellows, or pediatrics, it's going to be more than 40 hours a week, because you got to put in a little bit extra work to get up where you need to be.
Someone asked about multiple sites, which I know we talked about, but I can expand on that. David, I know, mentioned it. So we actually intentionally try to put fellows at multiple sites. If you live in Plattsburgh, New York, are you going to be at multiple sites? No. Everyone can go look it up later. Plattsburgh, New York.
You will be at Plattsburgh. Yeah. You'll be best friends with everybody in Plattsburgh.
Yeah. But if you're in Chicago, Buffalo, Columbus, Ohio, Grand Rapids, that we actually very intentionally want our fellows to work at multiple sites. I'm headed up to Worcester, Ohio tomorrow. They see like a quarter of their patients are pediatrics, where you might go to another clinic and maybe they only see a little bit, but they do a lot of procedure. So it is very intentional that the demographic changes broadly, right, from clinic to clinic. So our core providers often only work in about 1, maybe 2 sites. But for our fellows, we intentionally move them around to try to increase the different things you'll be exposed to in that year. Mm-hmm.
Mm-hmm. Are there exams? Yep, there are. There's a pre-exam that is just a starting point. Okay, so don't stress out about that one. And there's a final exam that you do need a passing grade on. But at the end of the year, it's all urgent care medicine. We're not trying to trick you up, but yes, there's an exam. And along the way, I'm not saying it yet, but there probably will be more exams. There's a paper you have to do, a couple of presentations. It's not difficult though. These are very straightforward papers. 3-page papers, pretty easy at this point in our careers.
Yeah, I mean, to piggyback on that, while I know it's easy to hear kind of all the rigor that sounds like that comes with the fellowship, and there really is some, but at the same point, it is doable. We have triple-digit people in our fellowship right now. The vast majority are thriving, and so it's not anything that's impossible. It's nothing that we set out to make more difficult than it needs to be.
Mm-hmm. The minimum grade. Well, that's a loaded question, Christopher.
Yeah, it's much more about competency than it is grades. We make sure that you know the information that you need to know, that you need to learn.
Academic support, it's vast. Again, we're going to give you every resource that you can possibly think of to enhance your knowledge. Any way that you learn, there's going to be an opportunity for you to use that module to learn, okay, that method to learn. If you're visual, if you read, if you are interactive, it's all there for you.
To piggyback off of Nick, so during our didactic, we do small group over the homework. So even that, though we have a large group, that's opportunity to discuss it with your LFB and your cohorts. We use Kahoot. We're probably a little obsessed with Kahoot to try to reinforce that information further. So we use a combination of things besides what you're seeing in the clinic. I know most of us are often asked, a week doesn't tend to go by that we're not reached out to and asked a medical question by the fellow. That's absolutely fine, especially the further along they get. Sometimes they're getting a little more autonomy and they just want to check in. We have soup docs at our disposal. There's mentors in the clinic. So yes, there is a lot of support.
Yeah. That being said, I think if you asked all of us, we would all agree that urgent care medicine is challenging. You know, that's why there's a fellowship. But it's fun. We all like it. Otherwise, we wouldn't be here.
You get to work with a great team, which I think really helps in that kind of situation. Very supportive team.
I think we talk a lot too about the goal of this year. You've gone to school, right? But this is a big shift to more clinical time of really, like, hopefully you're already getting there, but putting those pieces of critical thinking together. I usually tell that fellow, trying to make sure like you feel comfortable with how to think through a patient. If David comes in to see me today, I don't want you to just feel good treating David. I want you to feel comfortable with anyone within the realm of some sort of neck pain, shortness of breath that come in. How do we think through critically so that no matter what comes in, that you really feel comfortable kind of thinking through that process of what to do.
Mm-hmm.
Lizzie, do you want to talk really quick about kind of the follow-up here and what happens from this point?
Yeah, absolutely. So if you guys have registered, we have access to your emails. So what we'll do is, shoot out an email with contacts for myself, Maggie, and Emily. We each cover different regions. So we might, you might hear from us just depending on the region that you're interested in. But either way, we all, we can answer any questions you have across the board. So you'll have our contact information. That way you can, either shoot us an email, let us know that you're interested. If you want to send your CV, that's wonderful. We can also send over links that will allow you guys to schedule a phone screen with us at your convenience. So yeah, it's pretty straightforward. We definitely look forward to speaking to all of you. We just kind of chat to talk about, anything that you might have questions on specifically about your region, anything like that. And then, we'll schedule a interview with our lead fellowship providers. So pretty straightforward process, and very much looking forward to talking to you.
Yeah. Any final words from anybody? Anybody on the team?
The fellows are our future, guys.
Yeah.
Be well now.
Yes, I've been waiting all night, Mark.
Classic.
Yeah.
I forgot to do the fun facts at the beginning. Sorry, Martin.
It's all right. Don't worry.
All right. Well,
Really
thank
nice.
you everybody for joining. Sorry, Nick.